So I want to open this up, and I also want to make sure, Bonnie, if you can think about something to tell us about the role of the private sector came up in terms of new alliance and things like that. I think lots of times, especially in the public sector world, we're trying to struggle with what's the role of the private sector. If you can make a few comments on that, I think that would really help. So I want to give you some warning while we take a couple of other questions, okay? Because I'm not sure how many other people are involved in private sector. If there's others that want to talk about that, that's often an elephant in the room, especially with New Alliance and other things. Please, and can you introduce yourself?
Sure, thanks so much. I'm Jennifer Rigg with the 1000 Days Partnership, and this is all really terrific. My questions actually delve a little bit deeper on, John, thanks for mentioning, of course, the Sun movement. We have, I think, a groundbreaking opportunity in the next 10 weeks with the lead up to the high-level nutrition event hosted in London on the 8th of June. And so as a result of this speed dating, potentially the possibility to think about new commitments that could be announced there, as well as key events on nutrition throughout the month of June, with the new Lancet launch, of course, and a key event being hosted by many of the people in this room on the 10th and 11th of June here in Washington, D.C. But as a result, for example, there's a push not just for new financial commitments, but also increased transparency around which resources are going towards nutrition impact and which ones have the potential to do so over the next 3 years. And then finally, which game-changing policy commitments could be made. So I think this is the perfect time to be having this conversation. And I ask of this great panel, which top 3 interventions do you think would be most important? Maybe 3 isn't the magic number, but whatever you think could be the most strategic one. Because we just heard at a Sun meeting in Brussels last Friday that there's great work happening with nutrition costing, and yet, of course, there's going to be huge variability across the array of countries. So with the exciting work underway, knowing that there's always more to do, what does the evidence base tell us today would be those top, most strategic possibilities, not just for direct nutrition interventions, but also nutrition sensitive and those linkages and the integration approach, if you will? And then finally, what vision do you have for policy change for those next 10 weeks? Which commitments do you think could be made or should be made? Thank you.
We'll take one more and then.
Hi there. My name is Shaune. I'm with Save the Children. Thank you so much for this panel. It's been very interesting. John, when you started talking about integration, I was thinking, because I've been using that word a lot, I guess we all are using that word a lot, but I was thinking in terms of policy and national level, not just interventions and project or programmatic type integration between ag and nutrition, but departmentally, like, so these national governments, they have all these plans, they're, working through CADUP, they've got several donors, partners, et cetera, they've got Sun, they've got their own, like, poverty reduction strategic plans. How are those, is it obvious to some that integration is not happening, is happening? I just would like to hear your thoughts and comments, or any, anyone on the panel. It'd be interesting to hear.
Yes, please go ahead on that one, and then we'll go back to the 3 big ideas.
Yeah, the 3 big ideas. Well, they're kind of the same. I mean, I think if you look at where success has happened, one key component has been strong decentralization, strong devolution. And when you get to the local village cluster, municipio, panchayat, union parishad level, stuff is integrated. There are health committees, education committees, getting those things to function. So policy-wise, I think the number one policy thing that should be in national policies are standards, norms, resources for effective local level strategic planning and action. So, the kinds of behavior changes that are required for 1000-day nutrition, that's all going to be local. All politics is local. So in Brazil, one of the standards they set nationally to empower communities is that every local constituency had to have a professionally trained nutritionist as part of the team. So thinking of it, rather than thinking of these siloed national strategies, thinking of the national responsibility for creating an enabling environment for communities that work and for communities to be able to solve these problems. That's the kind of, so the number one intervention that I would have said was a strong, a strong national government supporting strong community governance on these issues, because that's where it's likely to be integrated. And second would be an absolute requirement for women's voice in that local governance.
Daniel, do you want to add to that?
Yeah, let me just make a general point here. I'm not a nutrition expert, so I possibly can't offer very specific answers, but I think one of the changes that I've seen that offers the greatest opportunity and the leverage that we can make here is this idea of local ownership. And CADAP has, just to give an example of Africa, has brought forward great political will to change and to make informed change. But I think what I have not seen integrated in that process is this idea of evidence from the field informing that change. It's basically bringing the researchers and the practitioners in the field to debate with policymakers, so as they create policies, these are informed by evidence from the ground. And I see that as a gap at the moment, but a great opportunity to close that gap because there is political will and people are listening. The other gap that exists is that a lot of this, if you look at many countries, they have these great development projections. So, for instance, in Kenya, they have a 2030 vision. In other countries, 2020 vision. And you read these documents, they are still at very, like 30,000 feet level. And when you try to figure out or talk to these people about what that translates in the field, in terms of investments in communities, it is not very clear. It's still very hazy. And I see that also as a big opportunity. There are dramatic changes occurring, for instance, with urbanization and the changing food preferences. And that is not yet coming to the table in these conversations about what agricultural research and development investments need to be made, so that they are not just typical investments that are being made, but these are investments that are responding to real needs now in Africa, in Asia, but also in the future. So this idea of projecting forward what kinds of changes are needed now to make sure that we meet the challenges of the future, I see this as a critical point where the research and development community comes into play.
Okay, thanks. Let me just add two things to that. So I agree very much with this enabling, how you can get this enabling of communities and to bring in WASH and all kinds of things that they need. And I think what we'll find is that we'll unleash a lot of innovation because they'll figure out how to do it better, as you said. Another thing is, and it's more obvious in some communities than others. I worked for many years in Africa and a lot with pastoral communities, okay? And pastoral communities, they never asked me a lot of technical things about how to raise their livestock or grow crops or things, because they know how to do that in their environment better than anybody else. They always asked me, how do I deal with the politicians? How do I deal with these other people? They want to know how to deal with the outside world. And so we had some interesting projects where we actually tried to arm them with evidence, with ways of influencing policymakers so they could go out and talk to their people, and it works. And they can actually make a difference. So I think that's one kind of hook on that. The other thing, and this is to segue into what I'd like Bonnie to talk a little bit about the private sector, is as we urbanize, and the developing countries are the most dynamic, the low income and the middle income countries, we need some very good, low cost, nutritious foods that people can eat, and they don't have time, so some of them are going to be processed foods, et cetera, et cetera. We got to think about how we work with the private sector to get that in a kind of public-private marriage, but we use the skills of the private sector as we have them now, and we unleash the skills, and you know them in Kenya and you know them in India, of frugal innovation and some of these other types of innovation that are really going to make this base of the pyramid thing work for nutrition. And with that, I'll hand over to you.
Can everybody hear me? Okay. It's always interesting when we come to meetings, they say, oh, gain, private sector. You get to answer for the private sector. Then really what we're about is using markets, right? How do we use the markets to pull nutritious foods in? With that said, there's a few things. When we do talk about the private sector, one often thinks of the MNCs, you know, the big guys. But we need to remember also that there's big regional companies, national companies, and even farmers are private sector. So let's not forget that most farmers would like to have a market for their products. When it comes to the private sector itself and taking a look at market-based approaches, you know, where gain comes from is that when you get things into the market, you're going to get the scale and the sustainability that we often want to have with nutritious foods, or what we do want to have with nutritious foods. But the question we need to be asking is, where are the poor and undernourished sourcing their foods? And yes, some is on farm. We all know that, and particularly with seasonality, the use of the market for the rural poor is particularly, I guess you might say, thin or sporadic. There are certain times of the year when the market itself is not necessary, and others where that's their sole source for nutrients. The other is local markets. We've got the big formal markets, but also the public distribution systems. And there are industries behind public distribution systems. Let's not forget that someone is sourcing those public distribution systems, and hopefully more and more they're local. And then so this whole thin market engagement and understanding where the poor are sourcing their food then allows us to think about what are the products. So that's where we come from. And then finally, I've been in many different meetings, and I'm kind of perplexed. You know, the private sector is changing tremendously. I mean, why are they coming to the table? Why now? And we could be very glib and say, oh, you know, they're seeing profit in the base of the pyramid. Yes, perhaps. It's not an easy profit to make, the base of the pyramid. So I think that we need to look at the private sector a bit differently. First of all, what is the private sector and the whole spectrum of what makes up the private sector from farmer to the MNC, but also what are those incentives that are bringing them there, and recognize that they touch your food. They touch it either as a seed manufacturer or they're touching it as a processed food in the kiosks outside the slums of Dhaka. The urbanization issue is enormous when it comes to the utility of the private sector in bringing nutritious foods. You know, if you live in a slum, you don't have a kitchen, guess what you're eating? So at any rate, I don't know if that was helpful, John, putting me on the spot.
It was
there.
helpful, and it's always helpful to put people on the spot. Yeah, so other comments? Yes, please. Oh.
My name's Ina Schoenberg, and I'm with University Research. And I don't know if this is exactly the right point to sort of offer the few things that we have, but I'll jump in. And it's linked to private sector, and maybe it's a segue to program, and we'll see. And so what I wanted to do was share a couple of opportunities that we might have that are quite practical, that we know that we or our project partners are looking for research partnerships. So the first is that came up earlier, relates to a program that we're working with in Uganda, where we're a sub under a private food manufacturer called RICO. They have a significant USAID, 5-year Feed the Future thing that was recently awarded, and they're already producing RUTF, and they're tasked with coming up with several new food products, probably for complementary feeding. They don't really kind of have plans on how to do that yet, and I think it could be a really interesting opportunity to link with sort of how and kind of document what works and what doesn't in terms of how you do that. We successfully worked with them under a previous project where we were the lead, now we're the sub, in making their RUTF. They're linking with getting TA also from Nutriset. It's approved by WFP. They're getting it approved by UNICEF, et cetera. So they've kind of got that, and it's being distributed via the national HIV/AIDS system. But they have a couple. So there's two needs with them. One is that sort of help in documenting and developing and then documenting how they're producing new products and then marketing them. And the second is that they have also taken on a big role in promoting ag production for starting with groundnuts, but also other products. And so the aflatoxin issues that were discussed a couple of months ago, being able to test practical means of aflatoxin control and monitoring for very small-scale farmers in 20 districts across the country would be, I think, of real interest, and we would be happy to sort of help them kind of figure out how to look at that and document that. Another opportunity that we have, we have a project called Traction, which is translating research into action. It's actually funded by USAID's Global Health program, and many of the small grants that we provide are related to health, but we have a couple on nutrition, and one of them is social marketing of fortified complementary feeding supplement in Ghana. So they're doing there's going to be a study of how well that their social marketing approach, we have a social marketing firm, is working. We will have sort of a findings event or something 18 months from now, and we'd be really interested in talking to others who are testing and trying out social marketing approaches because there is this price point issue as well as uptake in the community. So we're working with ESM, and they've got great methods for figuring out how to do this, but doing it for condoms is one thing, for complementary feeding products is another. And then finally, we're working also with a large Feed the Future project in eastern Zambia, and with CRS as the lead. We're providing the health and nutrition components, behavior change approaches, formative research for farmers as well as for the nutrition components. But CRS is very interested in strengthening the learning component of that program. So it's got all aspects: marketing, increased production, innovative technologies, you name it. But we'd love to help channel some kind of partnerships their way. So there were sort of a number of linkages there on practical ways and opportunities for partnership. If people are interested, I'd be happy to talk to them.
Yeah, thanks. That was very timely. Yeah. Other inputs people want to make? Okay, so I think we've had some pretty good wide-ranging discussion here, and these are all elements to build up to early June, as we're hearing, I think. So let's move on to the last kind of bundle, which is integrated programs. And Marie and Geraldine, hi. So there's been no collusion here, obviously.
Long day of meetings. You all. Okay, so programs. There's been quite a nice set of issues that have been discussed that actually bring us nicely into the issue of programs. So what we do, just quickly, we're interested in looking at integrated, complex programs and look at their impact on nutrition. We've been doing that for years. We've started to look at that before the 1,000 Days was invented, still with the focus on how can agriculture improve nutrition in the more broad term. But so the main question is really how can programs that integrate agriculture and nutrition and possibly other types of intervention, how can they improve nutrition? be it during the 1,000 days or outside of the 1,000 days. What does it take for these programs to work, and how do we generate the evidence that they work under certain circumstances and less well under other circumstances? What makes them work better and what makes them have a greater impact? And so we don't just look at before, after, and see whether or not we have an impact, but we certainly focus a lot on the impact pathway, which is where we think we're going to be able to generate information that's going to be useful for program implementers, because just knowing that the program had an impact, if you don't understand how that happened, or didn't have an impact for that matter, and you don't understand anything of what happened in between, this is not helpful for programs. So we have a genuine motivation to improve programs, to make them work, to make them have an impact and be cost effective. And so that's what we're looking at. So we're doing that with several different partners. Our most steady partner has been HKI, and we have Shaune in the back here. Victoria Quinn also has told me she would have loved to come but wasn't able to come. So we've done a lot of work with them. We're working also with Concern International now in Malawi, in Zambia. We work also on other kinds of integrated programs, not just agriculture, but programs that also have some elements of social safety net, social protection, cash transfers, food distribution programs, again, with the same general purpose of documenting what works and what doesn't work and how can we make it work. So on the other kinds of programs, we're working with CRS, we've worked with World Vision before, SAVE, etc. So Mercy Corps now in Guatemala. So we have a lot of experience working with program implementers, and those who have worked with us also probably have their own experience of what it is to work with us, and we can talk about that. We recognize it's not always a gift to work with us. At least there are lots of things that need to be accommodated. And I'm sure John will ask me to talk more about that, because it's a reality check. You know, it looks all very, very nice. Let's just do an impact evaluation, randomize, have a control group, and you guys do what you're told, and you implement, and we do the research. Well, we have to work together to do that. So basically, I don't know if you all have seen the recent reviews. There's been actually, as I keep saying, more reviews of agriculture and nutrition in the past 10 days than in the past 10 years than new research. So this field has been reviewed enormously. There is actually a new paper came out in 2012, I think, by Amy Girard, Webb Girard, after there was another systematic literature review, and after there were a lot of other reviews. And the reviews really all conclude that there isn't much evidence that agriculture programs actually improve nutrition. The recent reviews attribute a lot of this lack of evidence to the fact that the programs were poorly evaluated. So we often have programs that are not really using control groups, therefore they don't have a good comparison, a counterfactual. We have programs that sometimes have small sample sizes, therefore even if there was an impact, you wouldn't be able to detect it. There are lots of issues with program evaluation, but we also have done evaluations or also reviews before, and one of the things that's clear is that there are also lots of issues related to implementation. Some design issues. Sometimes the programs are not designed really to improve the nutrition of the young children, for example, or they're not targeted to do that. But other times it's programs of implementation. You have a very nicely designed program with all of the steps well planned, Very often the agriculture part works and the nutrition/health part works less well, and we've done research that has shown that. The behavior change communication in nutrition and health is probably always the weakest link in these programs, so no wonder they don't necessarily improve nutrition because that part of the intervention is weak. So we're accumulating this kind of experience and looking at the same types of programs, but with sometimes different packages, and looking at what are the commonalities across in terms of implementation weaknesses and what can be done. One of the things with our work with HKI that we had realized was that these programs had a focus on agriculture to improve micronutrients. So there was a strong focus first on vegetable rich in vitamin A, for example, and then adding the animal source foods because we know that the micronutrients are not that bioavailable in plant sources. And then the behavior change for mothers to learn to use the products and give them to their children and all. And but then those children were not getting the health inputs necessarily. So the children might have been exposed and consuming the orange flesh sweet potato or the green leafy vegetables, but they might have been sick all the time. And this program was not doing anything specific at the time to link the children to the health sector. So therefore, you know, we need both food, health, and care, and we also know that we need good water and sanitation. We need access to health services. So this brings to the point of integration that how much can these programs do? Agriculture and nutrition is already a challenge. Then you add health, you link them to the health sector maybe. Then you put on an element of water and sanitation. You put on, let's put an element of family planning or whatever. How much can you overburden these projects? It's still a question for us. And the famous question of integration, I was glad was raised. We really do have a question of, do we need to integrate or do we just need to make sure that the households get everything at the same time? So there's the real research question is co-location of all of these interventions as good as integrating? And we don't know that because it would really take a randomized trial where you have some groups integrate and they go through the whole process of integrating, and other communities, everybody does their thing, and it's like the model of, I think it's the model of the Millennium Villages a little bit, and unfortunately they don't have an evaluation system that we can trust, so we're never going to know. Different story. We don't need to get into that one. But all that to say that that's an excellent question, because I certainly have seen that program in the BRAC model, for example. BRAC is a great model. It's not focused on agriculture, but it's a health system model in Bangladesh where really the health workers are supposed to do everything and sell products and know everything about anything. They're like medical doctors walking around with a suitcase full of products to sell. And we're seeing that they're overstretched, that there might be areas where they're not doing as well. And so we do have an issue with the famous integration, because it's not integrating two things, it's integrating 6, 7 things. We need to press all the buttons at the same time, but in an integrated way or in a co-location way. So that's a question that we're still not answering with the portfolio of research that we have right now, but would like to do in the future. I think I'll leave it at that, and we can talk about the specific issues of partnerships in the second round.
Yes. Okay, Geraldine. Yeah.
And we're on. I'm encouraged to see that IFPRI and 1,000 Days Partnership has pulled this together and brought nutrition and agriculture into the same room. And so thank you very much for the opportunity to just give a little bit of perspective from the operational NGO side. I will start with this disclaimer that I am not the subject matter expert in this area, although I work very much in nutrition advocacy and policy. So for some of the nuts and bolts issues that hopefully you'll want to partner on, I can certainly direct you to the appropriate people within World Vision across sectors. So I just wanted to give a little bit of an overview on the direction that our organization has gone as just an example of what I'm sure our peers have been finding on the nutrition and agriculture nexus programmatically. As you know, World Vision is relief, development, and advocacy organization with a partnership spanning about 100 countries. And through this federation, our investment in nutrition programming has been about $41 million across 40 countries, reaching many direct beneficiaries. And historically, a lot of that work had been very nutrition specific. At the same time, in our development work, we were doing a great deal of agriculture and food security specific work. And over the past 15 years, that pathway has been changing as it has across the board in the field, to finding out how best to pull those together and to integrate and or co-locate, as Marie has said, this work. So certainly the heightened global attention to agriculture that we've seen, particularly with the food crises since 2008, the higher global attention is certainly welcome, especially raising the profile of the smallholder farmer, but largely it's focused on improving the availability of food and in so many cases missing the other components of food security, access, utilization, and stability year-round. I know that those in this room are very familiar with those areas, so I won't be going too much into that. But what we've certainly found from experience is that when we're looking for integration to truly work, nutrition outcomes must be an explicit objective of any agricultural planning, intervention, policy, or approach. And the same holds true for other sectors in development. And you mentioned some of them just a few minutes ago. So economic development generally, livelihoods, health, WASH, infrastructure, all these many different aspects really need to have nutrition sensitive recommendations built into the planning, metrics, and indicators. This is one of the things we're looking at as we look at the post-2015 agenda, and many of our organizations are working in that input process as well, and consulting and providing technical input for the thematic consultations. And essentially that's when we look at nutrition, we need to really ensure that those indicators, those targets are built in whatever the final framework of goals looks like across sectors and across target areas. So how did we get to where we are now? So our transition basically happened when we did an extensive evaluation of programming and found that although we had nutrition-specific interventions and we had agricultural work, this was not fully meeting the nutritional needs, particularly of vulnerable children under 2 and during that 1,000-day window. And at the same time, we had several pilot programs going on that were integrating agriculture, health, and other work with specific nutrition outcomes sought. So one example of this was the MICA program, which ran for 10 years in 5 countries in Africa, and where the approaches were varied. It was everything from fortification at mills to community level work and education to specific health referrals and health interventions. And this was a Canadian funded program, Ethiopia, Ghana, Malawi, Senegal, and Tanzania. And we found substantive decreases both in anemia among women of reproductive age, as well as in stunting in children in these countries. So one example was Tanzania, from 43% to 28% of children in the program areas stunted. So based on that, the Canadian government has also funded an extension program, Enhance, that expanded that over a few other countries as well, and has also focused on policy formulation at the national level. And our approach has been very much at the community level in service delivery and has expanded into social accountability. Our tool is Citizen Voice in Action, and we've worked a great deal with communities to build not just their knowledge, but their capacity to advocate with their local authorities and to form collectives where they can then bridge that gap from the national policy through the community level to the local level and make sure that implementation is happening in the communities. We have some excellent examples of that, which we'd be very happy to share. We'd also be very happy to partner in research on that front with the citizen voice and action approach. So I see my 5 minutes are up, and I will have to refer you to some other resources that we have, but just a quick note that we do have some research on nutrition in fragile states. We've been looking at scaling up nutrition in fragile contexts specifically. That will be coming out in just a couple of weeks, looking at DRC, Afghanistan, and Sierra Leone and Zimbabwe. So we'll be glad to share that with you as well. Mm-hmm.
No, thanks. That's very interesting. Just as an illustrative example, let me raise a couple of points to do with partnership for both of you, and they relate to how we work with development banks. Okay, so we're talking about going to scale. The World Bank, and Julie, you can correct me if I'm wrong. Their lending portfolio in agriculture is something like $8 billion. And their lending portfolio or their investment in nutrition is rather much smaller than that. Probably something 300 million or something like that order of magnitude. Now, the Agriculture and Rural Development Group say that about 14% of their programs are related to, have nutrition objectives, which was one call. And they want to increase that. So they're going to be looking for advice from people. And so kind of what's that advice, and how do we make those agriculture projects more nutrition sensitive and more 1,000 days oriented, probably? And that's, a lot of the agriculture people there would say no. And I guess related to that, what's the kind of evaluation then? Because it's easy to, I mean, here it's very rigorous, okay, and the counterfactuals, because, I mean, frankly, nutrition has, and stunting has so many different factors associated with it. But, you know, where can we use the gold standard, and what's the kind of support that we can give in these scaling outs to kind of lighter evaluation that would fit with, you know, most banks would have an evaluation budget of 3% or 4% of projects maximum, maybe 2%. How do we fit it into that kind of window? I guess that's one question. Difficult one, I'm sorry. But and maybe for both of you, because you go to scale in World Vision big time, we're talking about that. And, you know, what would be useful for you, I guess? What are you looking for?
Sure. Well, you know, definitely one of the huge challenges is that funding is sectorally based. It does tend to be that way. So immediately at the outset, program design and development is thinking from a sectoral point of view, unless you're really lucky enough to start with undesignated funds, which we often are, thankfully. But you know, that's certainly a beginning effort. Is you know, where is there room to work across agencies or across institutions and their departments to actually combine funding and approaches, and that's something that we're certainly interested in doing and have been working to do through some of those working groups. Yeah.
We're always looking for vehicles to evaluate too. I mean, it's nice to evaluate things that are going to scale.
Absolutely.
Marie?
Yeah. Yeah, I did think it was many questions.
Pick the part.
Yeah, I'll pick a part. Well, let's pick the agriculture investment, and they should all or not all have nutrition objectives, or how do we make them more nutrition sensitive? So my first question would be, what agriculture are we talking about? Because there's obviously an exaggeration right now of everything. Every agriculture investment should be measured against improvements in nutrition, and that's the Feed the Future model. And that, even for me, I've worked all my life, not all my life, but a lot of years trying to make agriculture more nutrition sensitive. But not to that extent. It's scary in the sense that they want to have nutrition objectives, but nutrition objectives often means we're going to measure nutrition as an outcome. So that's not a nutrition objective. The objective is we want to improve nutrition, and we're going to measure it by measuring stunting. It's a recipe for disaster because this is not a well thought through process of understanding, well, is this particular investment likely to have a nutrition impact beyond an income effect? Because yes, agriculture, if it focuses on increasing income, can have an impact on nutrition through income, but we all know that this impact is slow to happen, it's too little, too long. So it's okay in the long run, but if you want an impact in 4 or 5 years, don't count on if you want an impact in 4 or 5 years, don't count on income only. Okay, they might also add focus on women, target women, have a gender component. That's going to be another pathway by which agriculture can improve nutrition. But again, you need to do more than that, and that's the concern. And in reviewing some of the portfolio of Feed the Future, for example, you have Uganda, I think, where they have value chain for coffee. And I know Shaune hates when I criticize the value chain for coffee because we both really like coffee, but but I don't think coffee is making my nutrition better. On the contrary. And why pick on a thing like that? Why pick on a coffee value chain to say we need to make it nutrition sensitive when really, you would educate coffee farmers about nutrition, or, what's the link really? We're thinking of value chains, for example, that would make sense. That the dairy value chains, you have people that have cattle, they produce milk, they sell it all. They make more income, but they don't necessarily use this income to improve the nutrition of their children. So there you can have a lot of impact if you say, okay, we're going to work with this value chain and all the actors here to make sure that that people are aware that milk is good for their children, that it's good to keep some of that milk production, not sell it all, and also educate them into just general how you feed your children. So you can use that value chain as a vehicle, if you want, for delivering some direct nutrition interventions like behavior change, like also in northern Senegal, what we're doing with the milk producers is they sell their milk, and there's this small private company that makes fortified yogurt with it. Well, we bring back that fortified yogurt to them. We bring it back in terms of an incentive for mothers, for example, to generate, I always find it weird to say to produce more milk or to extract more milk from the cows. So we use it as an incentive for them to produce more milk and have more income, but also then it is a nutritious food that goes back to them, and we educate them about using it for the child, et cetera, et cetera. So the overall question of having a nutrition objective is insufficient, and it is probably not the way we should count. We shouldn't count, 40 or how many percentage, or 14, did you say? 14 has nutrition objective. Maybe it's fine. I don't know what the percentage should be. It depends on what the portfolio is. And then, as I was hinting at, what we have to think through when we look at these investments is, could they be a vehicle? Is there any reason why they could be a good vehicle for direct nutrition interventions? And there are criteria to judge that. Are they targeting the right population? Are they targeting the poorest of the poor? Are they implemented at scale so that you would be able to reach a lot of the poor with this intervention? If so, that's a point of entry for nutrition interventions. And so what are the relevant and most logical kinds of direct nutrition interventions we could integrate there? Don't just count on the agriculture project itself to improve nutrition. Add something else. Understand what the population needs and add some other inputs into this program. So it's basically, the bottom line is that you don't just want to have nutrition objective, you want to also have nutrition interventions in there in order to have an impact.
Okay, yeah. Is that, no, we need the, Stuart may have gone to bed, but we'll see.
Networking at the pub. So a question for Marie. I mean, it's obvious that you've spent a lot of time thinking about this and raising these, kind of very important questions. How can we take that and kind of bring your knowledge, the questions that you're asking to bear on the investments and the policies that, at least in the U.S. context, the U.S. government is making, but also other governments around the world in terms of agriculture investments? Because I think there needs to be more guidance and thoughtful questioning as to how programs are being designed. My second point was around actually the MDGs, the Millennium Development Goals, and two of the speakers have brought it up. It's interesting, the critique of the Millennium Development Goals, or one of the critiques, has been that it reinforced the silos and the sectors because in many respects, the MDGs are by sectors. So one of the things that the post-2015 high-level panel potentially may be considering this week in Bali is a life cycle approach to development, right? So what kinds of, let's call them interventions, for lack of a better word right now, are needed from cradle to grave to promote good development? And so obviously, the 1,000-day window, I mean, we're very interested in that and in that idea. But thinking about the life cycle approach, how can agriculture kind of contribute to the nutritional needs, the food needs, the caloric needs, throughout a person's life cycle?
And any other? We can collect a couple more points. Yes, please. Okay. And then
Hi, I'm Altrina
get Shaune and
Makuria.
then get Shaune first, I think, and then John. Okay. Sorry, please go ahead.
Okay, Altrina Makuria with Counterpart International, and we have some activities, MyApps, in countries where we are trying to integrate that agriculture and nutrition, and I think, Marie, you mentioned how important it is to bring in the nutrition interventions into the agriculture project. They've done that, but then you earlier said that when you do that, the agriculture works well, the nutrition doesn't work too well, and the behavior change is awful. So, and then we want to co-locate those in the same communities, in the same households, and we have to add this link to health because you have malnutrition, and so you have to do some CMAM, and you have to do some MAM work, and so on. How do we take those kinds of, the programs are so burdened to do this full integration and to be effective, and then impact malnutrition, which we know is a ridiculous indicator to give them to impact in the first place, but maybe impact further back on the pathway, improving the diet diversity or some kind of link. How can you pull out those gems and then share that with the broader community so that when they're designing programs and looking at indicators, that they pick those things a little further back, but will eventually have an impact on nutrition?
Respond or otherwise?
Okay, go ahead. Donald just confused you. He's next.
Oh, yeah. I'm going to respond. There's just too many things coming up, and I don't know where to start. But in terms of guidance, we are missing. We're thin on the critical mass of people, I think, that can help, and I think that's part of the problem that. There's a big need, a big demand for nutrition to help agriculture right now, and there's just almost not enough people, and USAID again is a good example of that, where there really isn't enough people to help. There is, however, I think there are some very useful guidance documents that have been produced. The World Bank Multisectoral book, for example, provides good guidance. Anna Herford has also reviewed the tools and the things that exist to help make agriculture more nutrition sensitive, and I think both are very useful. There's nothing like a real person versus a book to read, but I think still that this is some guidance. In terms of the life cycle approach, I couldn't agree more that. And this was something I didn't have time to talk about, but it may very well be that after all of this research, we find that actually it's not cost effective to ask agriculture to improve the nutrition of the children, especially. The 1,000 days include the mom, the pregnant and lactating mother, but the young children, it may just not be the best way. I mean, we hope that agriculture will contribute. We hope that agriculture will actually create synergies with direct nutrition interventions. But if it doesn't, let's give up on that particular objective and focus on the adults. Agriculture obviously can help the nutrition of adults, and there is a lot of needs in women, also in the life cycle. The girls, we know that pregnancy is not long enough to fix the malnutrition problems of women. We need to start a lot earlier, especially on iron and folate and all of those things. So if we can raise the population's basic nutritional status, then when mothers come into pregnancy, they're more ready. What needs to be done is less dramatic. You don't want to give them 120 milligrams a day of iron. Then we know the side effects. It's just not a good idea. So if you need to treat severe anemia while they're pregnant, it's pretty different than preparing them, and they're maybe mildly anemic, but not severely. So the life cycle is a great idea, and as part of the evaluations that we do look at all of the intermediary outcomes. So what, Altrina, you were suggesting as well, and I think it's becoming more and more recognized that maybe stunting is not the indicator here, but that dietary diversity or other aspects of diet is a better indicator. I don't think we have the evidence to really decide whether it's better or not, but we're collecting the data. We're collecting data on income, on food security, on food consumption at the household level, dietary diversity at the individual. And so we'll have all of this information, and we'll be able to say, well, it's really cost effective because you're benefiting an entire family with better diets. You're improving your dietary diversity of every single member of the household. But if you're not fixing the infections, you're not improving the nutritional status of children. So that's why we're doing all of this research, is to really be able to have a lot more to say about what indicators, what age groups, et cetera, et cetera. Was there another question? Well, and Altrina, you also brought together some inconsistencies in what I was saying. I was saying, do this and do that, but at the same time, it's not that easy. So the work with Ellen Keller, where we're documenting these issues of where there's a missing link or the chain breaks down a bit, all it means is that we need to work harder at that. I'm not saying it doesn't work, it never will, although BCC is stressing me out a lot because it's really hard to make it work. But it can work. The Haiti work we did with World Vision actually was an example where it worked beautifully. We have seen probably one of the best BCC implementation done in the context of a real-life example program. And there are a variety of reasons. There are places also like Burundi where we work where there's just nobody has any education. So it's not, you don't use the same techniques to do BCC in a place where nobody has education. And so I'm saying that there are difficulties, there are bottlenecks, but if we recognize them, the next step is to fix them or to see how we fix them and whether it's worth trying to fix them. So anyway, I've got to stop.
Okay. Shaune, please.
Marie has identified me as the missing link. I had two comments that are not really related. One was to this question about informing agricultural investments, and we've talked a lot about making them nutrition sensitive. And I fully concur with Marie that, you know, sometimes we're asking things to be nutrition sensitive that is just not a logical ask. But I think at a minimum we could ask that they do no harm.
Yes.
Mm-hmm.
And I think it's important we not lose that from sight also as being a contribution that at least agriculture is doing no nutritional harm for and clearly things that are displacing women from what have traditionally been their crops have potential for harm, that are increasing women's workload and taking them away from increasing their own energy expenditures, taking them away from childcare, et cetera, have real potential for harm. So I think that at a minimum we would want to do that. I wanted to speak I think what I think what IFPRI and HKI share in sort of a long-term vision of our mutual work, because it can sound pretty overwhelming, the level of research that's going on, but I would like to perhaps make a comparison to something simple like vaccine. You do all this work to see how, you know, it's all this upstream, incredibly intensive research work, but then once you have, you get the level of proof you need, that then you can follow a few levers, a few of the strategic pieces of your program if you roll it out, and you don't have to measure, well, is the vaccine effective in every context? You use coverage as your measure of that you can project effectiveness. And I think this is an ideally we would get to not having to reprove every time in every setting that this package of interventions is having the nutritional outcomes, but that we understand the pathways well enough that we can say these are the critical indicators we need to follow programmatically to say that we can have pretty good confidence that if we do these things right, it will mean we're having the impact. So I think this is why at this point we're investing so much in a very robust research agenda, so that down the road we'll actually have tools that will be lighter in terms of scale up for programs.
Thank you. And John, we'll give you the second last word.
And could you define the difference? And at kind of where does one draw the line? So if you think of a community governance sort of system, and there being services being sent in from different ministries, I mean, that's sort of both integrated and co-located. So is there a place where you draw the line?
Yes, please go ahead.
Okay, well, what I mean by the difference between the two is that we have tried that, and Stuart, if he's still there, would know better, the multisectoral, what was it called? Some kind of multisectoral planning in the 70s or something. So the goal was, you make all the sectors sit together and brainstorm and design together and try to implement together and evaluate together, and there was a big flop. It really didn't work. And we're coming back with the same thing, really, calling all these things slightly differently, but it's really the same thing. And the Sun is really pushing, and I think achieving a lot of this, at least at the dialogue level of establishing systems whereby there is real discussions across sectors. But we all know it's a huge amount of work. It's what we mean there is sitting down in rooms and brainstorming forever after about what my goals are and what your goals are and what my incentives are and what yours are and what are we trying, how can we work together and all of that. So there's a huge amount of effort in the process of integration. And so if we go to the field, for example, we have this region here where we want to improve the nutritional status of people in that region. So do we all sit down together, the WASH, the AG, the health people, the nutritionists, do we all sit down and make a grand plan of an integrated program that will integrate effectively all of these interventions and the connections between them? Or do we meet once and say, I'm going to do this, you're going to do that, and we're going to do that, and and we're not going to talk, we're just going to do it, and basically target the same people. So those people will get all of the interventions they need versus they would get them in an integrated way. And that's my question. Is really what's the outcome? What's the impact? So I'm not drawing any lines yet because I don't know. I've never done it. I've never tested, and I know it has been talked about, but I don't know that anybody has a research ongoing specifically on that. There's some integration analysis done in a qualitative way, But really just looking at what works in that sense. So I don't think we have the elements to really tell you where to draw the line at this point.
And are there one or two things that really need to come together, but the rest can be aligned or something like that? Let me just close off here. And a couple of things I wanted to say Shaune said very well, so I don't really have to say them other than I've been thinking about in this conversation like how we work with our partners to help them, and one of the new partnerships we're having is with EFED and helping them with nutrition. I was thinking, it'd be really good to just go through their portfolio and see how we could try and minimize harm across the portfolio. Might be a good way to do it as a first step. I like that. And that really reaches back to the kind of public health roots, which is, a big tenet of that. The second thing is, and this is also a point that Shaune's made before and why he's such an effective person in our management, is how do we translate some of the very good things we have with Marie through Helen Keller and other partners to really give them reach? And I think that's something we really want to consider from our side. And there's great examples of that. And because you partners have a lot of reach, how do we do that? I see that's an opportunity. We're going to, and I assume Lucy and team, you're going to organize us around how we're going to move to the advocacy piece, and those will be separate meetings, and we're happy to participate in those. So we're looking forward to that. But I think this has been a good kind of time and speed dating, and there's been a lot of honesty, I think, in terms of discussing things and saying what we think. And I think we all recognize we're always not right, but we're learning. And that nobody's miles ahead. Well, there's some people are quite far ahead and we can learn from, but I think there's a lot of learning that we need to do together. So I suggest that we go out and we start talking to each other and you identify people you've had, and we can continue the networking. But thanks so much. It's been very nice, and it's been a good way to bring in the middle of our meetings to really help us think through things. Thank you very much.